Good morning, everyone. My topic is placebo therapy in eyes. Is it getting rampant? So, basically, placebo is a substance or treatment that is designed to have no therapeutic value. We have conducted a very small questionnaire type study with about 50 patients who had symptoms like uneasiness, pricking, and watering. There was no significant abnormality on slit lamp examination, but these patients are very adamant that they want to use eye drops. So for out of the 50 patients, for 25 of them we have given drops, and for 25 of them we have just given counseling that you don't need any drops. Of which 18 patients of the ones in which we have given drops, they are very happy once they have come for follow-up, and in which again 7 of them they want better drops. They are not satisfied with these. And in the patients whom we have given counseling, few of them they have never returned for follow-up, few are convinced, and 15 of them they still want drops. So what are the different reasons why these patients are so adamant on these? Sometimes they misinterpret their common symptoms as something serious. They have this desire for quick fixes, that there'll be immediate relief for their discomfort or redness. And some patient they have as consumer mentality. There is lack of trust in healthcare professionals or the recommended treatment. They have some illness experiences and beliefs. And most importantly, in today's world, like they have the influence of information. The internet has made it easier for patients to become internet informed, sometimes leading to self diagnosis and demands for specific drops. So how is this placebo therapies related to eye related studies? They are used already in clinical trials, dry eye diseases, glaucoma therapy, and also in certain vision therapies like convergence insufficiencies. When we come to dry eye disease, here the placebo effect is a major consideration, where the control treatment, known as vehicle, is not a true inert substance. The act of adding liquid to the eye provides temporary lubrication that can improve symptoms. Studies on dry eye disease reveal significant improvements in symptoms and certain signs in patients receiving a placebo or a vehicle. There can be a positive placebo response. There is a study called DREAM study in which participants on placebo showed significant improvement in subjective symptoms. Whereas it can also have larger effect for more severe symptoms. In the same study, it was shown with a phenomenon called as regression to the mean. But there is no long-term benefit. There was a meta-analysis in 2022 saying that placebos did not show a long-term beneficial effect on key dry eye disease symptoms and signs. When we come to placebo effects in glaucoma, it was effective in lowering IOP compared to baseline with a greater effect than no treatment at all. But this could potentially limit the ability to evaluate the efficacy of a new medicine. The magnitude of the placebo effect in glaucoma trials has been linked to factors such as larger sample sizes and add-on study designs. So why does basically this placebo effect occurs in eye therapy? One is because of the patient expectations. They believe that the treatment will work, can trigger the brain to release substances like endogenous opioids and dopamine, which can modulate symptoms like pain and comfort. Sometimes it is due to therapeutic contact, that is, supportive interaction with the physician can create a positive expectation of recovery even from an inert treatment. And physiological effects of the vehicles, like DED trials where they are not truly inert, and the moisturizing effect of the saline can provide temporary relief. And regression to the mean, where natural fluctuations in is their condition mean their symptoms would likely have improved anyway without an active treatment. So there are certain advantages like scientific reliability and safe for patients in research because of placebo. And disadvantages are mainly their ethical concerns in direct treatment, variability, their ineffectiveness for eye conditions, withholding effective treatment, and limited generalizability. So why is it problematic? It is basically because of the ethical concerns, because sometimes deceiving the patients by giving them inactive substance while implying it to be an active treatment is unethical. It damages the trust, that is, the lack of transparency can erode the patient's trust in their doctor and the healthcare system, potentially leading to a harmful long-term relationship. There is something called risk of nocebo effect. Instead of improving well-being, placebos can sometimes cause negative side effects such as nausea or drowsiness. Then it can be a lack of benefit for conditions like dry eyes. it can improve symptoms, making it an ineffective strategy for genuine patient care. So, how should we properly use placebos in healthcare? Uh, whether when if we are using it in the clinical trials, it should be an informed consent. Patient should be informed that they may receive an inactive substance as a part of study, ensuring ethical treatment. And the primary goal of clinical practice is to provide beneficial and effective treatments, not to rely on deception. So, finally, what I would like to say is patient satisfaction should be achieved through transparent communication, accurate diagnosis, and effective treatments, not through the unethical or ethical use of placebo eye drops. Thank you.
Your observation that in glaucoma cases there is an IOP drop with placebo is interesting. Like the way, yeah. So
Yes, yes,
actually,
yes.
yeah. Actually, no. What I am trying to say is like the very diagnosis of glaucoma generates so much anxiety for the patient, and the very fact that they are using some eye drop gives them so much relief, maybe contributing like in the management of glaucoma for intraocular pressure reduction. Nowadays, the uh, study that was initiated by Dr. Tanush Dada at
Yes, yes.
AIMS about mindful meditation is really working. It is almost about 20% IOP drop is seen by 365 breathing. So these are the contributory factors, because once you tell the patient you are probably glaucoma also, mind you, patient will never sleep peacefully for the rest of his life. So that's a point well taken, and this is an interesting finding. I should say that the using even a placebo drop is contributing to some intraocular pressure fall. So it basically reduces the stress for the patient, I feel.